All right, we'll start again. Good afternoon, everyone. Thank you for joining us for our weekly COVID-19 community update. I'm joined today by Monroe County Public Health Commissioner, Dr. Michael Mendoza, Dr. Michael Apostolakis, Chief Medical Officer for URMC Strong Memorial and Highland Hospitals, and Dr. Robert Mayo, Chief Medical Officer for Rochester Regional Health. We're going to start by checking in on our numbers. We're reporting today 183 new COVID cases, which brings our 7-day average of new cases to 164. Last week, we reported 213 new cases and a 7-day average of 193. We're still seeing fluctuation in those numbers, although they're on the downswing this week. That's good news for our community. However, we continue to be classified as an area of high COVID transmission according to the CDC. As for vaccinations, we keep making good progress. More than 461,000 Monroe County residents have completed their vaccine series, and about 494,000 have had at least one dose. That means roughly 5,000 more residents received their first shot over this past week. So about 77% of our eligible residents have had their first dose, and 73% have completed their vaccine series. Our mobile vaccine unit has been successfully deployed into our community, and we are working hard to get those life-saving doses to our most underserved populations. We have several vaccine clinics scheduled in neighborhoods throughout the city of Rochester in the coming days, as well as other locations throughout Monroe County. All the information on times and appointments can be found by visiting our website at www.monroecounty.gov/health or by calling our COVID hotline at 585-753-5555. Vaccination remains the best and most effective tool our community has to combat COVID-19. It's free, it's safe, and it works. If you're eligible and haven't had your shot, today's a great day to choose vaccination. We also have our $100 thank you gift cards available for vaccines at a number of our sites. This runs until the end of the month, September 30th. So you can see more information on that, again, at our website, monroecounty.gov. But please keep in mind, we have the $100 thank you cards available at a number of our vaccine clinics through the end of this month. Yesterday, the FDA approved booster shots for seniors and other people in high-risk populations. Our team is continuing our efforts to scout locations for sites to offer those booster shots as we await more information about when those efforts can begin. Meanwhile, we're continuing to hire administrative clerks, nurses, and EMTs and others to help get these sites up and running. We offer flexible schedules, both in terms of number of days and number of hours, as well as competitive pay that ranges from $17.50 to $28 an hour, depending on the job. You can find the details and applications, again, on our website, monroecounty.gov. And I know the state's vaccine mandate for healthcare workers is still a concern for many people who are worried about possible worker shortages stemming from healthcare employees who are leaving their jobs rather than getting vaccinated. Can make it harder to get life-saving medical treatment. I want this community to know that access to life-saving medical treatment will continue to happen. URMC released some great information earlier today about where they stand in terms of having healthcare workers meet the state's mandate. 99% of their professional staff and 91% of all hospital employees have gotten their vaccine so far. That is great news. And I am pleased to report that we see very similar numbers at Monroe Community Hospital, where just like URMC, 99% of our advanced practice professionals, such as physicians, nurse practitioners, and physician assistants have been vaccinated, and 91% of all employees at Monroe Community Hospital are vaccinated. And those numbers continue to increase as we approach the mandate deadline. We do have some agency staff at the hospital with lower vaccination numbers, but we're working very hard every day to encourage more vaccinations. We know the state is firm on putting this mandate in place, and the governor reaffirmed that yesterday while here in Rochester. So we have taken steps at Monroe Community Hospital to prepare for all possibilities. We have put a temporary pause on new admissions, reassigned some aides to clinical care, and trained other workers with new skills, just in case they need to be redeployed to support our clinical staff. Doctors Apostolakis and Mayo will talk more about possible impacts and updates from their healthcare system in a few minutes. But I want to be very clear here. There will be no interruption of critical healthcare needs. Our hospitals are open and ready to care for critical healthcare needs of our community. Yes, there may be some inconvenience in healthcare delivery and some contingency plans that are going to be executed as we approach the mandate deadline. But our healthcare systems have long been grappling with a shortage of staff, and that's only been exacerbated by COVID and the demands this pandemic has put on the people working in the system. I can assure you that essential and critical care services in our healthcare system will not be impacted. If you or your loved ones need critical healthcare services, our healthcare system will continue to deliver high quality care without interruption. The state, county, and healthcare systems will work together to ensure high quality care we enjoy now will continue with as little disruption as possible. But I need to add an important message here. Let's remember that our healthcare workers have been the front line in our fight against COVID for the last 18 months, a full year and a half. And this fight is not over. They are tired, they are stressed, and they deserve our gratitude. In the beginning of this pandemic, we were all very good about recognizing our healthcare heroes and the sacrifices that they make to care for our loved ones. Do you remember we put out lawn signs, we sent cards and letters, and showed up outside the hospital to demonstrate our appreciation? Now some of our healthcare workers look out the hospital window and they see protests and anger. To me, that's very disappointing. That's not support. COVID hasn't gotten any easier for our healthcare workers. In many ways, it's gotten harder and it's more exhausting because it's been unending. So on behalf of Monroe County, I want to say thank you to each and every healthcare worker who has taken care of us through these difficult days and who will take care of us in the days to come. I want you to know that you are still our heroes. I want to thank every one of you who has gotten vaccinated because you recognize that you have the power to end this. You know that the only way for this pandemic to end is for all of us to get vaccinated. And so now I'd like to turn this over to Dr. Mendoza.
Good afternoon, and thank you, County Executive Bello. And as I stand here with my colleagues, Dr. Michael Apostolakis and Dr. Robert Mayo, I have mixed emotions. On the one hand, I am incredibly grateful for the vast majority of my healthcare colleagues across Monroe County who will be reporting to work on Monday. We will be here to take care of our patients because that is what we all signed up to do. It is our calling, our passion, and our commitment. We are vaccinated against COVID-19, not because someone told us to, but because we know it is the best way to keep our patients and colleagues safe. And it is the best way to keep ourselves and our families healthy. We know that the Pfizer vaccine is FDA approved, making it no different than any other vaccine we would take without any question. We know all of the vaccines are safe and effective against severe illness and death for COVID-19. On the other hand, I am saddened because a small minority of my colleagues may not be joining us on Monday morning. I know there are many reasons for this, but there has been ample opportunity to research, learn, and understand the science behind these vaccines. There has been ample time to learn the facts and to overcome the fear. And I hope my unvaccinated colleagues use the next few days to really dig deep before choosing to leave this noble profession. Every one of you is incredibly important to this community. Every one of you is among the healthcare heroes of this pandemic. You stood firm during the hardest days. Getting a safe and effective FDA-approved vaccine is incredibly easy by comparison. But whatever you choose to do, I want to assure the rest of the community that we are not in a crisis. If you are ill, call your doctor. If you are sick or injured off hours or can't get in to see your own doctor, go to an urgent care. If your condition could be life-threatening, no matter what time of day or night, go to the emergency room. These healthcare services are not going away. My colleagues and I are going to take care of you. Will you see some changes in the provision of healthcare? Yes. Dr. Apostolakis and Dr. Mayo will have more to share about this in a few moments. But as we fully understand the limits of what we can do, we will be working on solutions because keeping our community healthy and safe is our job. It is our responsibility, and the vast majority of us are not going anywhere. Before I turn this over to the chief medical officers, I want to provide a brief update on our schools. We are seeing on average about 40 positive new cases per day in our schools. And for the most part, the students and staff who are infected are doing so outside of the school environment. Just like last year, schools continue to be very safe, provided that everyone is following CDC guidance, especially regarding vaccination and masking. I would be remiss in not mentioning the hard work and commitment of so many families, administrators, faculty, and staff. By and large, you are showing an incredible commitment to educating our children while keeping them safe and healthy. Thank you. We are working very closely with the schools to set up surveillance testing. And at this point, I am not concerned about the supply of test kits for the weeks and months to come, something I know other areas may be experiencing today. I'll be happy to address any questions related to these remarks after we hear from our colleagues, Dr. Apostolakis and Dr. Mayo. Thank you.
Thank you, Dr. Mendoza, and thank you, County Executive Bello. Dr. Mayo, always a pleasure to be here with you as well. And thank you, as always, to the news media. My statement will be brief because I understand that you've seen a news release we published today on the vaccination rates at UR Medicine and the impact of the state mandate. There are just a couple of points that I'd wish to emphasize. One is to echo what others have said. Vaccination is the most important step people can take to protect themselves, their families, and our community from COVID. I extend a wish from me and our entire URMC family to please get vaccinated. Our faculty and staff are stressed, and the one thing the community could do is get vaccinated. Higher vaccination rates mean fewer hospitalization and fewer deaths. The second is that the health systems across the country have faced staffing challenges for months. This makes it a challenge to maintain all of our services, even at pre-pandemic levels. As the state's vaccine mandate takes effect Monday, we will face some additional challenges. Patients are likely to experience some delays or inconvenience in receiving non-essential care. We ask for the public's understanding, but UR Medicine hospitals will remain open for business and ready and able to provide essential care. So if anyone in the public needs medical care or has symptoms or unsure about their symptoms, please call your doctor for advice and don't hesitate to visit one of our hospitals for care. Thank you. Dr. Mayo?
Yes, thank you, Dr. Apostolakis, Dr. Mendoza, and County Executive Bello. It's a pleasure to be here with you as always. I'd like to start by sharing just a robust, heartfelt thank you to the many thousands of healthcare workers who have valiantly served this community over the last 18 to 24 months. They have really shown their commitment through long hours of work and self-sacrifice. And without them, we would be in a much different place than we are today. I also want to thank the community members who also suffered and endured through this pandemic. I know that it remains difficult for you to have a loved one in the hospital and have restricted visitation hours, or be screened every time you walk into a healthcare facility. These changes in our usual patterns of life have been difficult to adjust to, but I appreciate all of the respectful acceptance and compliance that you have expressed over these months. It is true that the ongoing pandemic poses, an exhaustion factor for all of us, and it will and has permanently changed many of the ways that we are delivering care. But we're grateful that we can continue to serve this community. As Mr. Bello said, there is emergency services available, critical care services, and though there may be longer waits in some of our emergency departments, those services are available to this community, and we are committed to maintain those services. I'm also very proud of the vaccination rates of Rochester Regional Health employees. Those vaccination rates have been rising day by day over the past weeks, and they continue to rise day by day. And I'm pleased to say that Rochester Regional Health will be reaching very high percentages, nearing 100% for our employees over this mandate, this regulatory requirement issued by the state. I'm also grateful for the many people who are working overtime to provide care for this community. At times, there will be shifts in the services that we are able to provide. This will be assessed on a day-by-day basis, but it is possible that some of our laboratory draw centers and other facilities may have some restriction in their hours or changes in the location of services in order to consolidate services to ensure that this community has what it needs. So I'll turn the time back to County Executive Mr. Bello.
Thank you, Dr. Mayo. And Julie will manage questions.
Thank you, County Executive Bello. Our first question comes from Brian Sharp at the Democrat and Chronicle.
Thank you. This would be directed both to Dr. Pastelakos and Dr. Mayo. I was wondering, I guess for the URNC, the announcement was more than 23,000 have been vaccinated. I think, just quick Google searching, that leaves possibly around 3,000 who have not. Could both of you talk about which service areas in particular you might be concerned about going into next week based on the numbers you're seeing?
Right now, we have made contingency plans based on best in case, worst case scenarios. And our numbers are changing almost every day. We have made contingency plans to assure that essential services continue no matter how many or which types of workers aren't here on Monday. We, at this point, it'd be premature to say that I'm any more concerned about one area other than the other than to say that we will be able to provide the essential services our community needs.
I think that's a very accurate, in the moment response, Dr. Pastelakos, and it's very similar for us at Rochester Regional Health. So, you know, there's a diverse workforce. Many of our workforce are cross-trained. So if there are major gaps in essential workers impacting care or services in one area, we plan to shift individuals to try and close those gaps. So I think the most accurate statement for the moment is for the public to check in with their healthcare providers if they have appointments scheduled, to ensure that schedules are on time, or if there's been changes in the location or the timing of the expected services. And we will support our patients, our community through all of that.
And for Dr. Mendoza, I was wondering, you mentioned about the schools, and we had talked last week about what you're seeing with people's buy-in, parents, students, for the, I guess, the random testing. Can you talk a little more about that? Have you gotten a better picture of what you're seeing across districts?
Well, as we had planned earlier in September, the schools have undertaken a process to survey their students, their faculty, their staff, to ascertain which students and faculty and staff would be open to being tested. We know that the unvaccinated students are required to be offered testing on a weekly basis, and the majority, if not all of the schools, public schools at least, in this county have elected to open up voluntary testing to all students. And so they're in the process right now of understanding how many of the students will consent, how many of the parents will consent on behalf of their children. And once we have those numbers in place, each of the school districts has a plan in place to determine how many of the subsample of those consenting individuals will be tested on a weekly basis.
All right, thank you, Brian. Our next question comes from Patty Singer at Minority Reporter.
I think we'll stay with Dr. Mendoza to start off here. He's all warmed up. In the data from Labor Day till the last set of cases by age came out, for the children under 10 and under 19, those cases had doubled from Labor Day to now. You did mention increased cases in schools and where you think that's coming from, but put that into some context. Are hospitalizations among children going up? Is it more serious illness? I mean, it's other age groups. The cases numbers seem to be the same, but that doubling in 2 weeks in kids seems to be alarming. Is it? Provide the context, please.
Well, we anticipated this to some degree because as college students came back to the area and as our K through 12 students went back to school, we anticipated there would be more testing in those age groups. So when you test more, particularly in an age category that is largely unvaccinated, particularly 11 and under is not vaccinated, it's not surprising that we'll see more cases. Thankfully, we're not seeing that translate into any significant increases in terms of hospitalizations. But remember, for hospitalizations in this age group, we're not ever going to be looking at huge numbers of hospitalizations. But what we are looking at, unfortunately, are very sad situations where otherwise healthy, individuals in their, teens and 20s and younger, who really should not be hospitalized for any other reason, if they contract a severe case of COVID, which does happen, that's certainly something that's going to be very troublesome for that family and for that individual. So we don't want to measure the burden of childhood cases only in terms of cases or even hospitalizations, but really it's those few individuals who are going to bear really a disproportionate burden of this illness. So the number one message, of course, is still to get vaccinated once you're eligible.
Okay, thank you. And for the health systems, I understand that elective surgeries at Rochester General are being suspended, but as we've heard numerous times, critical care is still available. But at what point, because of staffing delays or other reasons, does routine care then become critical and add more to the burden that is already in the health systems?
Patty, thank you for the question. I'd like to clarify one thing. Elective surgeries are not being suspended at Rochester General. There has been some rescheduling or reshifting of the schedule to lessen some of the tightness of that schedule. And we will continue to assess that each day. So elective surgeries are being performed there, and our ambulatory surgery centers are also providing surgeries. I'm sorry, what was the second part of your question?
At what point, with routine care has to be even delayed or rescheduled, at what point does that become critical, adding to the burden that you already have?
Right, yes, of course. And well, that has remained one of the key questions for this entire pandemic. And we did see and do believe that a year ago, when the routine care was routinely canceled or delayed, that patients later returned with health challenges that we would have hoped could have been avoided, or diminished. So we are very attentive to that. We are continuing to offer our ambulatory services. We have not closed any of our ambulatory practices at this point. So we intend to continue to offer patients services. If there's a change in that, we'll of course let our patients know. But at this point in time, that's not our action.
Right. Thank you, Patty. At UR Medicine, we have elected starting next week to not add elective cases. We haven't canceled any yet, in anticipation of not knowing exactly how many staff we will be losing as of Monday. But as I said previously, we have contingency plans to continue essential services as needed. If we lose a significant number of staff come Monday, it will impact elective procedures and surgeries. To what extent, it's still unknown, but we will be here to care for patients. Once again, the one thing that we know that can help is vaccination. As we sit here today, we have over 50 patients at Strong Memorial Hospital that are here because they have COVID. We have over 110 patients throughout our system. That's a significant number that are requiring healthcare, the majority of which would not be here had they been vaccinated. So the community can help us maintain the essential services we need to do and the elective services by getting vaccinated. And the question of what point exactly is going to trigger really depends on how many staff we lose.
Thank you.
Thanks, Patty. Smriti Jacob from Rochester Beacon, do you have a question?
I don't. I'm all set. Thank you, though, Julie.
Thank you. Raquel Stephen from WXXI, you're next.
Yes, thank you. Thank you, doctors and county executive. My question is in regards to the percentage of staff that have applied for exemptions or are exempted. In the release earlier today, it said that the percentages does not include those in medical and religious exemptions. Do we have a number of those who have received those exemptions or applied for those exemptions?